Well, right now, California is the only state that requires hospitals to test for fentanyl during drug screenings in emergency rooms.
But here in Indiana, the state has just set a record 2 years in a row for the number of fentanyl-related deaths. Our Samantha Johnson is joining us looking into why those tests are not required here. A lot of people asking, like, why not just make that across the board?
Yeah, and especially when you hear that those tests, according to doctors out there in California, only cost the hospitals about 75 cents. And doctors there say that any hospital in the country could add that test today if they really wanted to. So I asked some of our top doctors here in Indiana what's going on and what we're doing about that. So the chief of the emergency department for Eskenazi Health, his name is Dr. Tyler Stepson. He put it like this. He says requiring this sort of test if someone comes in with a suspected overdose would not change how the doctors treat that patient. He says all overdoses are pretty much handled the same way regardless of what's in your system. And he says the priority will always be treatment and long-term care. Dr. Stepson says opioids tend to present similarly in patients. That can look like low respiratory rates, small pupils, and little to no response to pain. So he told me rarely, if ever, does he need a drug screen to diagnose what's going on.
If it were true that, and I don't think that the literature bears this out, but if it were true that having fentanyl in your system scares you into not doing drugs anymore or not using opiates anymore is what the secret sauce was, then yeah, I think we'd all add it tomorrow. But that isn't the case.
Now, on the flip side, he says where this test could be beneficial is for patients who are on maintenance therapy for opioid use disorder, so doctors know for sure what's in that person's system.
You know, so I'm wondering, is it safe to say that this doctor is actually against requiring these fentanyl tests?
He
kind
is.
of sounds like it.
Yeah, he is, especially when it comes to making this a requirement for all overdose patients. He says the priority really needs to be looking at the individual person one at a time rather than these test results or numbers. And I actually talked to doctors at other hospitals too who say they agree. So we will have more on their reaction coming up later this morning at 6:30.
That was surprising for me to hear because I just assumed that everyone would be on board with it, but hearing it broken down from people who obviously do this every day in that light, it does give a different perspective. Looking forward to hearing more. Thank you, Samantha.